on the road. So good morning. My name is Katie Weldon, and I'm the Programming Director for the Mississippi Gulf Coast Chamber of Commerce. And if this is your first time coming to one of our events, I want to welcome you. The mission of the Chamber is to connect, inform, advocate, and develop. And we do that through programs such as these. So I really want to thank our sponsors, Memorial and Hancock Whitney. Without them, we wouldn't be able to host these programs complimentary. So thank you so much. And on that note, I would like to give a moment to give some sponsor remarks.
To the people stepping up in the face of an unprecedented challenge, we say thank you. Thank you for everything you're doing to serve our communities and keep us safe. To the people of Hancock Whitney, thanks for being the ones our clients can count on. The comforting face in the window, the trusted advisor, getting it done for the people we serve. Because even though it feels like everything has changed right now, it's reassuring to see that some things haven't.
I'm Heather.
I'm RJ.
I'm Sinead.
I'm Stephen with Hancock Whitney.
I'm Zanae with Hancock Whitney, and I'm here to help.
We'll get through this the same way we always do, together.
Thank you so much again to Hancock Whitney and Memorial. We really appreciate the support that you give us with our Ask the Expert series and throughout the year with our other events as well. As I stated before, the mission of the Mississippi Gulf Coast Chamber of Commerce is connect, inform, advocate, and develop. And I see with us this morning, we actually have a few board members with us. Thank you for joining us. And of course, to our Chamber President, Ron Barnes, thank you for taking the time to join us. So as I mentioned earlier, in case you missed it, there is a Q&A box here. So if you're on your laptop, if you hover over our screen where Cindy and I's face are, you'll see a Q&A box. You can put your questions in there and you can submit those anonymously. The only thing about questions is we ask you don't put any personal or any identifying information out there. But remember, no question is a stupid question, especially when it comes to COVID and the vaccine. So please don't be afraid to ask, because now is your time to get the correct answer from a medical professional. To make sure you get the full experience of this event, make sure when you send a chat, you're putting it to all panelists and attendees. And make sure if you're on your mobile device, you go to Facebook and check into this event so you can prove to your family, friends, your boss that you were productive this morning. Join us for our upcoming events. We're going to put those in the chat as well for you to register, such as our Women Educating, Enriching, and Engaging, featuring Alexis Williams, the owner of Aloha Glamour. All of those links will be in the chat box, and you can register for those via our website, mscoastchamber.com, or via our Facebook page. At this time, I would like to welcome our CEO, Ms. Adele Lyons. Good morning, Adele.
Good morning, everybody. Thank you so much to Memorial. Thank you, Ms. Hansen, for your time. You know, we talk all the time about health being the most important thing to everybody. And this is individual health. This is our community health and our business health, and certainly learning more about the vaccines and how they are going to affect everybody. They will affect our community. They'll affect our businesses. They'll affect your employees. And so it's important that we stay very, very informed on this information. So thank you so much for your time. I know y'all are super busy doing vaccines and testing and taking care of folks, but to kind of play it forward and let people know about the vaccines is super important. Appreciate you.
Thank you, Adele. So our Ask the Expert program is designed for professionals to gain insight from top leaders in the industry on hot topic issues, best business practices, or such as today is COVID. There are sponsorships available. So if you need your business to be seen by thousands of people. Each event, we get over 5,000 views on these logos. This is the perfect opportunity to get your business seen by the public and by our members. And on that note, I would now like to thank you all for joining us this morning, but a special thanks to Ms. Cindy Hansen, Director of Employee Health, and all the Memorial team for taking the time to speak with us today and providing so many helpful resources for our community. On that note, I'm going to stop talking and turn it over to Ms. Cindy.
Thank you, Katie. I appreciate the time and for you guys inviting me to come. I'm going to share my screen, and I've got a little PowerPoint information here. I'm hoping that I will answer a lot of the questions that some of our viewers may have today. Please note that most of the information on here is either CDC, OSHA, Mississippi Department of Health, or just general experience from what we are seeing here at Memorial, as we have been in vaccination mode for about 5 weeks now. So let's get started. So the first thing before we get into the vaccination is all of us know, what is COVID-19? We all know that it's a virus, SARS-CoV-2. The reason this is such a big deal is because the coronavirus has not been seen before. It came onto the playing field in 2019. We've seen other coronaviruses, but not this one. This one was new, or you will hear novel. So we know that the people can get COVID-19 through contact with somebody else that has had the virus. It is typically a respiratory illness, but it can also affect other organs. Some people will get mild symptoms. Some people will get severe symptoms. The thing is we don't know what we're going to get. So that's why it is very important for all of us to do prevention and to everything that we can to try and prevent this from occurring. Symptoms may appear 2 to 14 days after exposure. That is why some of the recommendations are to quarantine for the 14 days. The symptoms: fever, chills, cough, shortness of breath, fatigue. All of these symptoms, you can see they do mimic the flu, but in a little bit more of a severity. So we cannot go forward if we don't know the numbers. This was something I pulled actually today because I felt that I'm a very visual person, and I think that it is helpful for us to know why we are doing all of this. Why are we trying to vaccinate? You can see our U.S. population, 331 million, and out of that, 25 million have had COVID infection. Only 7% of our entire population has had COVID. You see the media, it is lit up. Our hospitals are full with COVID, and we have only seen 7% of our population with it. Mississippi population, 2.9 million, and only 256,000. That's a lot of people in Mississippi that have had this virus, 8.6%. So you can see that we have a lot of work to do to help prevent this COVID vaccine and to stop the infection. So first thing, vaccine development and safety. My goal today was to show you that, maybe give you a little bit of comfort that even though there has been a discussion that this has been rapidly produced, you have to know that there's a process, and at each stage and phase of the process, safety is of the utmost. So you can see here, this is just a graphic. Don't get swirled up about it. It looks a little busy, but it basically says that, first there's a research, clinical studies. Then they go to the clinical studies and trials, phase 1, 2, and 3. All throughout, there are many regulatory organizations that are watching to make sure that there is not a lot more harm than benefit being done. Then the FDA reviews all of this. How effective is it? Is this something that we need to continue going? They give approval, and then the ACIP will then give it. The Advisory Committee on Immunization Practice will then give their recommendation. That's what we hospitals go by. And once they have done that, then we enter a phase 4, which is we start giving the vaccine, and then we watch for continued safety events, risk events, things like that. So again, I beg your pardon. Vaccine development is a process. It's a very long process with multiple hard stops. And those of us in the that deal with computers, we know what a hard stop is. Okay, that means that we cannot proceed any further. So the trials, FDA determines safety and effectiveness. They then make a determination to allow it to be used under an emergency use authorization. Then they send that to the advisory committee, and then they make recommendations to CDC. After it is authorized, then all of these entities, the CDC, the FDA, all of the federal partners will then use all of their systems to make sure that it continues to be safe. I will talk a little bit more about this VAERS system, which is a national system that collects all the reports of adverse effects a little bit later in the presentation. So what is required for a vaccine or a medication to qualify for EUA or emergency use authorization issuance by the federal the FDA? First, will the product be used for serious life-threatening disease or condition? COVID, check. Based on the totality of the scientific evidence, is it reasonable that it's going to be effective? Yes. The known potential benefits outweigh the risks. Well, we have people that are dying every day with COVID. They are having chronic long-term problems because of COVID. It is definitely a huge risk out there that we need a solution for. And there is no adequate FDA-approved alternative. There is nothing else to prevent. This is it. So besides doing what we've been doing, which is the masking, the social distancing, all of those things, the hand washing, all of that is good preventative practice, but there is no treatment. So right now, there's only 2 COVID vaccines that have been issued at emergency use authorization, and that is Moderna and Pfizer. So Johnson & Johnson has a vaccine in the pipeline as well. And apparently in about 2 or 3 weeks, we should see that will be the 3rd product that will likely get issued a EUA. The Johnson & Johnson product is 1 vaccine, and then the Moderna and the Pfizer is 2. And I put the links on here, right here. Basically, if you wanted more information, you could go to these links and it'll give you the recipient fact sheet, the FAQs for each of the vaccines. Very easy to find. Just type in Moderna or a Moderna fact sheet, recipient fact sheet, and you will find this information. It is required to be handed out when you get a vaccine. So the vaccine is a messenger RNA product, and it is difficult to understand this technology, but I kind of am making it very simplistic because if you're like me, you care about the science, but you really want the product, right? So coronaviruses have a spike-like protein structure on their surface. And the way the messenger RNA vaccines, they tell the cells to create this harmless piece of an S protein. It's the spike. That's how the virus gets into the cell. So the cell itself, the body, the immune system then takes over and says, oh, that protein piece is foreign. So I need to make antibodies. I need to protect my host from this invader. So that's how it stimulates the immune system to build antibodies. So that is the generic how messenger RNA works. Basically, it works on the protein, and then it tells your body, it gives your body instructions on that to make that protein, and then the immune system does what the immune system is designed to do, react. This is what it looks like in scientific terms. All of these cells, they're all part of our immune system, and that is why it creates the memory, so that if the body ever was exposed to this virus, it would mount a response. So why should anyone consider taking the COVID-19 vaccine? So here's the why. Here's my why. Rather than delivering a virus, these vaccines are not live virus. It gives you a harmless piece of information and it helps your body to create a response. COVID-19 can cause a severe medical complications. Obviously, I think all of us probably know someone who has been sick with COVID or, God bless them, have passed with COVID disease. There's no way to know how COVID-19 will affect us. We could be very mild symptoms, but we could spread the disease to family and friends that we love. And that is why I got it. One was because I got the vaccine because I didn't want to bring it home to my special needs son. So I was trying to protect him from getting any disease. I work in a hospital. I'm around patients all day long. So I wanted to make sure that I didn't bring anything home to him. He was at risk. So getting the COVID-19 vaccine, as I said, it can help protect us by creating antibodies without us actually being sick. I mean, that is the goal. We don't want to be sick with COVID. Getting vaccinated will also help protect our family around us, those with at risk of severe disease. So what are the differences between Moderna and Pfizer? And I didn't add Johnson & Johnson because that's still being worked out. Besides the fact that they are created by two different manufacturers, here's the stuff that will just, some people will love these slides and other people will just loathe them. But basically, in a nutshell, they look at several different things when they're comparing. The target population, Pfizer is 16 and up, Moderna is 18 and older. Their efficacy or their effectiveness in preventing symptomatic disease is about the same, about a 1% difference, 94% for Moderna, 95% for Pfizer. Both vaccines are 2 shots. Pfizer is 21 days apart or 3 weeks, and it's a 0.3 of a dose. And the Moderna is 2 shots delivered 28 days or 1 month apart, and it's 0.5 cc. So between the two, the Pfizer has to be mixed with a diluent of saline. The Moderna does not. It comes in a vial of 10 doses and you just draw it up and give it. So the other thing about these two vaccines, Pfizer and Moderna, Pfizer requires a lot different storage, a little bit more attention and concern to not having any lapses in the temperature. It has to be transported in ultra cold. It's like -70, which is crazy. Most places don't have those type of freezers. It's like a tissue freezing type temperature. You can, once you thaw the bottle of Pfizer, you have to use it in 5 days. So it's not as friendly for those of us that are utilizing the vaccine. The Moderna, it is stable, refrigerated for 30 days. Gives us some time to make a very well thought out plan, and it is stable for at room temperature for 8 hours, and it will also be much. You don't have to freeze it in the ultra cold. The other thing is both of these have to be, once you open a vial, you have to give it within 6 hours. So if you ever hear anybody say, well, we don't want to open a vial yet, well, that's because you're looking for 10 people. 10 people in a vial, doses in a vial. So we are trying to be very good stewards of the vaccine that we've been allotted from the state. So, we are trying to be very good about preserving that. Possible side effects are pretty much the same regardless of what vaccine. There's post-vaccination with any vaccination. You can get injection site pain, swelling, inflammation, redness. And then you get the other general malaise, headache, muscle pain. Both vaccines, their side effects are a little bit more common after the second one. And that makes sense. If you think about it, we get the first shot and we're telling that body to create antibodies. And then you give it a second shot and it's like you're you're just boosting that effect. So your body has already seen it once and has created antibodies, and now you've just injected a little bit more. But that is necessary to get the full protection. So please, if you're going to consider getting this vaccine, please consider getting the second one, unless you have serious adverse effects and your provider has said, nope, you shouldn't get it. And that is very rare. Most people can get the second dose. Safety for pregnancy, both of them, there's not a whole lot of data available. We are telling our staff, if they are pregnant, to discuss it with their OBGYN to make sure that, that all of the risk benefits have been discussed, before they get it. We already talked about storage and then all of that. So here's the ingredients. I was asked to include the ingredients. Well, most of all of this is the lipid that the messenger RNA is transported in. So that's the liquid you see. A lot of the Pfizer ingredients over here, you see the sodium chloride, that's probably the diluent. There's some similarities, there's some sucrose and some other things, but really, in the big thing, it's all chemical. The following, which is very interesting to me with the vaccine, with the COVID vaccine and the messenger RNA COVID-19 vaccine, is that these are not exclusions. So if you have food allergies, oral medication allergies, latex, eggs, gelatin, pet dander, venom, environmental allergies, that isn't a reason for you not to get this vaccine. I have heard just recently that people were concerned, they have an allergy to penicillin or sulfa or something, and they didn't want to get the vaccine because they had heard that there was a contraindication, and that is absolutely false. I will just tell my business out there, I'm allergic to 5 different medications, and I took 2. I've had both of my vaccines, and I am here living and breathing, no horns, no extra appendages. So I have, there is no issues with any of this listed here on the page. Those people that had a precaution to a vaccination or maybe a history of anaphylaxis, regardless of the reason, will be asked to wait 30 minutes, not just 15. All other persons should wait at least 15 minutes after the vaccine to make sure that there is no issues immediately afterwards. Because at the end of the day, this is a new vaccine and we're all learning every single day more and more about it, but we feel like we have a really good handle on it. Almost every place that is giving vaccine has emergency prevention in place. So who shouldn't take the vaccine? Anyone with a history of an allergic reaction to any component of the vaccine, of course. They've actually expanded it to even, at first it was very general. And now as more and more people get vaccination, they've decided that polysorbate, if you're allergic to polysorbate, polyethylene glycol, those 2 components are in the vaccine or actually aren't in the vaccine, but they are showing that there is signs that there may be a reaction. So you should definitely not take it if you have that or any other component of the vaccine. There are very little exclusions on why you shouldn't take the vaccine. So screening before vaccination, all of our vaccination clinics, at least in the Memorial system, I suspect all over, will have a consent form. And basically through the manufacturer, they have given us what they feel that we need to screen. And basically the screening allows us to educate people. Do you have a fever? We do not want to vaccinate somebody who is already fighting something. You want your immune system to be ready and to create those antibodies. If it's already busy working on trying to get you better from something else, that's not the time to get a vaccine. You need to wait until your fever is resolved, you're feeling better, and then your body will be able to mount the appropriate response at that time. We ask about pregnancy because we want to educate people about that. Do you have any shortness of breath, dry cough? Again, we're trying to assess, are you sick? Should you get it? This other question, have you recently been in close contact with somebody? We're just trying to see, could you have COVID already and maybe not know that you have it? Maybe you have these other symptoms. So we're trying to screen out people that maybe should wait. The other thing with vaccines, we asked, have you had any other vaccines in the last 4 weeks? The recommendation is that you should not take a vaccine, any other vaccine, 2 weeks before or 2 weeks after you've had a COVID vaccine. So really that is good practice anyway, because we want to make sure that the body is prepared and ready to make those antibodies, and it can have undivided attention to that COVID-19 messenger RNA. Again, the other thing that we have kind of putting a little bit more emphasis on is, do you have implants, fillers, facial? We have noted that there has been some reactions, people that have had fillers in the past. So you're talking lip fillers, maybe cheek, dermatologic fillers. Is it, what will happen is there'd be a little bit of inflammation. So you could have if you have lip fillers, you could have a little bit of swelling in your lips. Does it go away? Absolutely. Is it not so appealing for someone to have full lips when they have a meeting tomorrow? Probably so. So anyway, just so that they are aware of that, some people have been told to pre-treat by the vaccinator. That could be a variety of things. Could be some Benadryl, could be some other things, could be steroids. I'm not here to prescribe or do any of that, but just to let you know, there is a plan for people that have had those, because that is not a disqualifying at all. So significant to note and be prepared. If you don't want to be sick or have had fever within the last 24, 48 hours, I said that. If you are immunocompromised or suppressed, there is a possibility that the vaccine will not mount an appropriate response, like as high as you would want it to be, because your immune system is weak. So it's not going to create that large-scale antibody protection. It will probably create some, but maybe not as widespread as you would like. Same thing for this facial fillers. It is transient, it is temporary, but just to be aware of it. And the biggest thing that we have been really careful, and we've tried to be very transparent with our employees here at Memorial, has been that you want to plan on a day when you have 24 or 48 hours to recover if you do have side effects. Obviously, we're in the patient taken care of business. So we want to make sure that we have staff here to work and take care of our sick patients. So even though we want to get that vaccine out as fast and as quick as we can, we had to stagger what we did so that we wouldn't take out all of our ER or ICU or respiratory therapists, because we want to, or any of our staff, because we wanted them to plan. When you get your shot, have a day to recover, hydrate, and just be prepared. So what can you expect? We said injection site reactions, pain and tenderness. You can get that with any vaccine. Some people have had some swelling or hardness. I would say if you get any of that, you're going to ice or heat. I would change it up. First, I am always a big proponent of ice, but a lot of people, it's uncomfortable. Ice is uncomfortable. But if you're having inflammation, you want to ice it, cool it down, calm it down. If heat makes it feel better, maybe you alternate, but don't forget the ice. General side effects: fatigue, headache, muscle pain, joint pain, chills, nausea, vomiting, fever. And you look at all this and you're like, oh my gosh, why do I want to do that? Why do I want to put myself through all this? Well, this is just 24 hours. So if you get COVID, it could be 2 weeks, it could be 3 weeks of this, it could be a lifetime of chronic conditions if you get the virus. So this is a small penance to pay to get protection. So general recommendations post-vaccination. If you experience side effects, treat the symptoms as they come. I have been researching this because as healthcare givers, a lot of people, they're like, pre-treat. When we have our kids, we take them to get their childhood shots, we would always say, oh, I gave them Tylenol because I don't want them crazy, after they get their shot. Well, the sources are saying to wait 5 or 6 hours after vaccination or when you start to develop symptoms, whichever is longer, to try and not impede the body from mounting that good response to the vaccine. There is a level of comfort that you want to, if you're starting to get a headache, take some Tylenol. Go ahead and treat those symptoms as they come. Routine prophylaxis for the purposes of preventing symptoms is not recommended at this time because they just don't know the information of the impact of using this prophylaxis like Tylenol or ibuprofen or Advil or whatever on what the effect is on a vaccine-induced antibody response. So my general guidelines is what anybody would do if they were coming down with a cold. Post-vaccination side effects will resolve and it will be 24, 40 hours. Very rarely will it go into the 72-hour realm. But rest, listen to your body, hydrate with water. Don't drink any alcohol during that time because that is dehydrating. Water is your friend. Tylenol for the fever, muscle aches, joint pain, and just weather it for a day or two, and it'll be like a light switch after all of a sudden you'll feel better. There is a time period when you're like, oh my gosh, I'm so sick. I think I might have gotten COVID. Well, then 2 hours later, you're perfectly fine. Well, that's the vaccine. It's just your body mounting that robust immune response. So I said earlier about safety reporting. All of the entities have a very strong purpose to make sure that all along they are continuing to record, get the data, analyze the data. So I am encouraging anybody that has any side effects, whether they think it's related to the vaccine or not, go ahead and complete this information. Let the CDC, let the powers that be determine what is common and what is a variant or just a one-off. So side effects that may preclude you from getting another dose, that is when you should really consider doing a VAERS form. This link right here will take you straight online and it will take you to this page right here. And you just click on it and you can either do a PDF, you can print the PDF and fill it out, or you can fill it out online and it automatically, you submit it and it goes straight to where it needs to be. They analyze the data. They may connect back with you if they have questions, but I haven't had anybody get a call back. We've given over 5,500 vaccines and we have a little handful of theirs, but all of them, but I think 2 are getting the vaccine, got their second dose. So the other thing that is available to you is Be Safe, and that is from the CDC, and it is a smartphone-based tool that checks on you after you've had the COVID-19 vaccine. So what you do is you just click on this cdc.gov coronavirus, and it's safety. You can Google Be Safe, and it'll take you to this Be Safe after vaccination health checker, and you'll just register. And then you will answer a few questions, and then it'll tell you you'll tell it when you got your vaccine, and then it will, if you start having symptoms, you just text it to them. And, it's just another tool for us to use to check in and for them to check back with you. So all of this information, I mentioned it at the beginning, it's when we give a vaccine, we are required, because it's an emergency use authorization, to do several things. One is we need to give you a piece of paper that says it's the fact sheet for the recipient. Within that 3-page front and back information packet, we'll have what to expect, who to call if you have problems, what links you need to go to report an adverse, what side effects you should be concerned about. And all of those things are in this packet. So keep that packet for dose 1 and dose 2. The other requirement is a card. It is an immunization card, and it says what lot number you got, what date you got it, and who gave it to you. And on the back, it'll tell you what date your second shot is due. So it's another reminder that you need to get that second shot. And, we have a going theory here at Memorial that we think that vaccine card is going to be your okay to travel card eventually. Some entities I feel that will want to see, did you get vaccinated? A lot of airlines now, you have to get swabbed in order to travel. Well, what I think is as we get more and more vaccination out, they're going to want to see your card. Were you vaccinated? We're just guessing, but we want people to keep that in a safe place. So I've got a few questions in here. I hope these are valid to you. But one of the very top ones that we get all the time, if I had COVID or get COVID in between the 2 doses, should I still get it? Yeah, but it is my recommendation and most infectious disease recommendation that you would wait 90 days post-infection to receive the vaccine. Number one is because you already have some immunity from having actual disease. So you have some time to get it. Let some others that haven't got any immunity get the vaccine. And the other thing, make sure you're completely resolved with your infection. The State Department of Health, the CDC, is saying that as long as you're recovered, you can take the vaccine. But I'm telling you, my experience, those people who have had COVID and then get their shot pretty quick have a very robust, that's my word of the day, very robust response to the vaccine. That means they get they feel like they're getting COVID again. They hot fever, malaise, major body aches, like can't get out of the bed. So it only lasts 24 hours, but it is a very robust, and that is expected because the body, again, is smart and it has memory. And when you give that vaccination, you are like waking up the immune system and all those antibodies that it created and mounting that response. So it's just your body doing what it's supposed to do. So as long as you're aware of that, I do believe that you need to get the vaccine because we don't know how long that natural immunity is going to last. We're still fresh into this. We don't know yet. But 90 days at least, if you've had COVID. If you get COVID in between your vaccine, same thing. You got to wait 90 days. And it's okay to wait, even though it's out of your 28-day regimen or 21, whichever vaccine you're taking. So we addressed this. Can you get another vaccine at the same time? No. You need to wait 2 weeks before, 2 weeks after. And that's really important right now because we're flu vaccinating, right? So just make sure that you plan accordingly. 2 weeks after, 2 weeks after, before. Can I get the COVID-19 vaccine if I'm pregnant or breastfeeding? I have had people that are pregnant. They've taken the vaccine. They've had no problems. There's people that are breastfeeding, no problems. But again, it's a personal decision, as any vaccination is. You need to make the decision that's right for you and your baby, but be educated, ask the questions, go to the professional, the OBGYN provider. They will be able to help you make the appropriate decision. So after getting COVID-19, will I test positive for the COVID-19 on a viral test? I've had a few people that got their vaccine, and then 2 or 3 days later, they tested positive for COVID. They thought, oh, well, it was the vaccine that gave it to me. No, that was not the case. They were already exposed. The timing actually was just coincidental. But none of the vaccines currently in here can cause you to have or test positive in any of the viral tests that we have. If you get a PCR or an antigen test, that is current infection. So you didn't get it from the vaccine. You already had it. And remember, it takes 14 days. You can if you after exposure to get it. So just keep that in mind. If your body develops an immune response, which is our goal of vaccination, you may test positive on some antibody tests, but we're really looking at that. We don't really know if the current COVID antibody tests that are out there are actually detecting the antibody production from this messenger RNA. So jury's still out on that. There is no plan to test antibodies after vaccination at this time. more information needs to come out on that. So I threw this in just because I know a lot of folks that are watching are probably in some of these tiers. So we are currently, healthcare personnel, our nursing homes are getting immunized, people 75 and older. We actually are 65, we're actually right here. Persons age 65 and older, persons age 16 to 64 with high-risk medical conditions are now qualified to get the vaccine. Currently, the Mississippi State Department of Health, all over the state, are the ones that are immunizing the community at present. Singing River, Memorial, several of the other hospitals were allotted a certain amount of vaccine, and my understanding most all of us are out of what we've been issued. And if we get a little bit, we're going to open it up and get it out as soon as we can. That is our goal, is to vaccinate our community, and that is how we make a difference, and we can affect here on the coast our COVID positivity rate. So the biggest question that I always get is, after vaccination, can we stop all this garbage with the masking, social distancing, staying 6 feet away, doing all the hand washing? I don't think we're done with that for a while. It takes a bit to get herd immunity. Y'all have heard this terminology. It's basically community immunity, if you think of it like that. It takes a certain amount of either active or passive immunity. So active if you have the disease, passive if you have the vaccination and have antibodies, to afford the protection to those without immunity. So take 74-75% of the community to protect those that doesn't have any immunity. So we're not there. We are totally not there yet. So until we get closer to that, we're going to be wearing a mask. We're going to be social distancing, and all of these preventative actions that we've been doing for now 10, 11 months is going to continue for a little bit longer until we can get this vaccine production elevated and get more people immunized. But remember, at the end of the day, there is no vaccine that is 100%. Even both of these vaccines that are fresh off the block, they are 94, 95% effective. There's still, you've got to be smart when you're in the community and when you're with your family. You need to use good infection prevention practices. So let's talk about gloves. And I'm talking about this because this has been a burning thing. We're doing a lot of publicity. We're doing a lot of education. We're trying to get the word out. And, when we were so excited to get that vaccine out, we took pictures, we took video, it hit the mainstream, Facebook and media. And the biggest thing was not, oh, we got a vaccine. It was, oh, they're not wearing gloves. We don't have to. Just here to tell you, here it is right here. Wearing gloves is not required when we're administering vaccines unless we have open sores, cuts, or anything on our hands. I am wearing gloves in this picture when I'm immunizing one of my buddies, but it was not necessary. And to be honest, we need to be good stewards of our PPE. So if you see someone fixing to give you their vaccine and they don't have gloves on, as long as they've sanitized their hands before and after, you're good. So, and that's what this says. Persons administering vaccinations should follow appropriate precautions to minimize the risk of exposure and spread. Hands cleaned or washed prior to giving the vaccination and between patients. And that is what we are doing. So, sorry, that's my little public service announcement on that. Final thoughts. The goal of this presentation for me was to give you some information so that you can make an educated decision about whether or not you want to take the vaccine, how important it is to you, what is the risk versus benefit. If you have doubts, talk to your provider on what your personal risk is, your family risk, and what the benefits of those are. And we are providing this education to our staff before they get it, because even though we're healthcare providers, you know, this is all new to us too. So we want to make sure that each one of us have a unique medical profile, and we want to make sure that we are addressing all of those factors. So here's some more resources for you: Moderna, Pfizer. There's COVID vaccine general information from the CDC, the ACIP recommendations for COVID. I put those in here, and I can share this to Katie, and she can post it out. I have no license to all of this. I created it, but I took it from a bunch of information from all over the internet that's very available. Just tried to compile it for you. So here's the questions. I got my second vaccine, and I am ready for questions. Katie?
Yeah. All right, so we did have a few questions come in. If you have any questions, there's a Q&A box. You can submit your questions anonymously or have your name with them. But let's go ahead and get this started. So, Miss Cindy, first question. Will Memorial Hospital of Gulfport consider drive-through and appointment system similar to the health department versus first come, first serve?
Yeah, we actually are in the process right now of scheduling our second doses for our community events. We gave about 2,400 vaccines out on February 4th and 5th, that are due the 4th and 5th. And we're in the process of scheduling those appointments currently to eliminate the wait times and to also distribute the masses so that we don't have big groups together. So that is one that we are doing. The other thing is, going forward, we are looking at trying to find an adequate place to do a drive-by vaccination. So stay tuned. We are obviously trying to make sure, how are we going to get that information and the vaccinations to a wide group of people, knowing that we need to, that not everybody is able to get out of their car, not everybody's able to stand for long periods of time. Our initial effort, our goal was to get that vaccine in arms. That was it. And we kind of just went out and did it. And then that night we looked at it, we finessed it a little bit more. We, got a bigger area, chairs, it's just a progress thing. We're just learning as we go. But yeah, I think the short answer to all of my rambling is that yes, that is being looked at.
That's great. And for all the work that y'all are doing, thank you so much. We can't thank you enough on behalf of the community. Thank you for all that you're doing and being able to adapt so quickly. Another question somebody had was, should you take Tylenol before the shot?
So there is many different camps about that. We did it for years with our children, giving them Tylenol before we gave our vaccines to them. The recommendation right now is to treat the symptoms as you get it. What I'm seeing, people aren't even getting any symptoms until like 7 hours later. So do you really want to take something and it's not needed? So maybe, 4 or 5 hours after that you got the vaccine, if you start feeling a little malaise, a little fatigue, maybe a little headache, go ahead and take and treat that. But I would recommend treat the symptoms. There really isn't a whole lot of efficacy about pre-treating or prophylaxis.
Next question. Can you mandate your employees to take the vaccine?
At this time, an emergency use authorization, we are not mandating our employees to take this vaccine. In the future, who knows? Currently, if with our flu, if you don't take the flu vaccine, you have to be masked. Well, we're all masked right now, and I don't know what that's going to look like going forward. Right now we are not mandating it.
With this new variant, will the vaccine still work?
Moderna and Pfizer and our infectious disease, everyone has said that yes, it is effective with the new variant.
Excellent. Can you naturally be immune to COVID?
Naturally, whenever you say naturally, I think of you probably had an exposure, your body created the antibodies and you have immunity that way. We haven't seen this virus before. So I don't know that unless you've been exposed, had COVID, or had vaccination, that is the way you get immunity. You aren't born with it.
Okay. How long does the vaccine last?
Right now, they're saying that we don't know. I mean, just going to be honest with you, we're not, from the studies that we've seen, people have been immunizing since early on with the clinical trials. The jury is still out on that. What our infectious disease, y'all have heard Dr. Pinnico, Dr. Conger, they both said they feel that it'll probably be a year. We will probably have to do a booster. But again, we just don't know yet. We're waiting to see what, as more and more people get the vaccine and more studies come, we're waiting for that time, that duration, and all of the data that is created from prolonged after the vaccination to find out how effective was it in preventing COVID-19 infection.
That's great information. I feel like I'm learning something new every minute. Next question was, a lot of people that have received the first dose are having trouble scheduling their second dose. How important is it to get the second dose right at the recommended 21 to 28 days?
So that is the first date you can get it. So 21 days for Pfizer, 28 days for Moderna. However, get it as soon as you can afterwards. Your immune system has been exposed one time. Now we're just get the vaccine when you can. It is important to get it and not wait months and months and months and months. But, if you have to wait a week because you're having a surgery or you're out of town, don't panic. Just schedule it after you get back. But get the second dose so that you can ramp up those antibodies and get the full level of protection. Because after the first vaccine, you get some protection, but it's the second booster that gives you that 94 to 95% protection, which is what all of us want and what we all need.
Absolutely. Why is it so important for people to know the facts about the COVID vaccine instead of listening to myths and rumors?
Well, we combat in the healthcare industry myths all the time, from flu, having that cause virus, infection. It is very important to me as a healthcare giver to make sure that the people that I am providing care to, whether it's vaccination, whether it's evaluation, whatever it is that you are informed. You need to make the proper decision. Don't listen to somebody that is just, I don't know where they're getting their information. I would hope it's not a political thing, or maybe they're on some other kind of, maybe they're anti-vaxxers. There's a lot of people that don't like vaccines, and that is okay. That is for them. But make sure that you, as a consumer of medical care, are informed. Go to the correct places that are using science to base the information on, not perception, not their own opinion. This is, my opinion is everybody should get a vaccine, but I have done my due diligence. I have researched it. I've gone to the CDC. I've gone to the State Department of Health. I've gone to the FDA. I've actually gone to Moderna so that I was very well versed in all of the side effects so that I can make that choice for myself. As a healthcare consumer, you need to do the same.
Absolutely. Persons aged 16 to 64 with high-risk medical conditions, would pregnancy count as high risk?
Possibly. You may actually, maybe you're a diabetic. Maybe you're diabetic, pregnant, African-American female. You would be very high risk, so you would need to discuss it with your OBGYN to see if, what is the risk benefit of you getting the vaccine? if you have diabetes or hypertension, or you are obese before you got pregnant, you have 3 huge risk factors. So you need to really consider whether or not that is something. They may have you deliver and then take the vaccine. That could be what the provider, the OBGYN decides. But in the meantime, you need to protect yourself, keep yourself safe, follow all of those other prevention guidelines.
Okay, next question. Why are all medical professionals, doctors included, not on board with the vaccination? You have discussed short-term side effects, but little attention has been given to the potential unknown long-term side effects.
Right. One thing I know is that the long-term effects, even after 6 months of having COVID, is devastating. So as a person, as a consumer, that is why I chose to get the vaccine. If we want to move forward in this pandemic, there has to be something that we need to do. We have to be actively engaged, and the science is there. With any vaccine and medication that we use, there are always side effects. We don't know the long-term effects of some of these meds, but the benefit today outweighs that risk. And that's where each individual needs to weigh personally for them alongside of their provider. To be honest, I have an autoimmune disease. I have a special needs son. If I got the disease, or my son got the disease, the long-term effects mean nothing, because it could be deadly for him, for me. So even if 20 years down the road, they discover something, but if I don't ever get to there, then why should I, I guess that's where I'm thinking it through. Right now, I need protection, and that's how I'm basing it. But that is me.
Thank you for sharing that as well. And this is our last question. Do steroid medications taken for autoimmune affect the vaccine?
So it suppresses the immune system. I'm on a biologic with immune suppressors. I actually coordinated with my rheumatologist. When should I take the vaccine? I want my immune system to bounce up. I want it to be ready to take and make those antibodies. So timing with your immune, your treatment, whether it's steroids, whether it's a biologic, talk to your rheumatologist, talk to your provider, and see what would work best for you. Same thing for chemo, for some of the other immunosuppressing treatments. Talk to the provider on when. We've had people that said, hey, I need to get my vaccine this week because this is the best week that I can get it, because I'm due for my next chemo, which will repress my immune system on week 3. So they will, that will sometimes guide when we need to give it.
Absolutely. Cindy, thank you so much again for all the information, for keeping up with all this and doing your due diligence and your research. We can't thank you and the team at Memorial. You are truly the heroes right now. And as always, we appreciate all that you've done and for taking the time to speak with us today. I also want to thank our sponsors for today's event. That's going to be Memorial Hospital of Gulfport and Hancock Whitney. Without them, we wouldn't be able to host this event. Complimentary to the public and to our members. If you are interested in sponsoring this program, please reach out to me. And if you're interested in joining the chamber as a member with all the benefits included with that, please go to mscoachchamber.com or give us a call at 228-604-0014. I want to thank Cindy Hansen again, Director of Employee Health with Memorial Hospital of Gulfport. And I hope everybody has a great day. It's a beautiful day to have a beautiful day. And on that note, I will be sending out a survey after this with event links and all the links that Cindy posted in her PowerPoint as well with all that information. Cindy, any final thoughts before we head out?
Nope. Stay safe. Stay well.
Absolutely. Everybody have a great day. Thank you so much for joining us this morning.